Hi, I'm Dr. Matt Fontaine. I'm the Clinic Director for Tricor Performance Therapy, and I'm here today to talk about a non-invasive treatment called active release techniques. One of the things that separates us at Tricor Performance Therapy is that we specialize in active release techniques. Active release techniques is a very effective non-invasive treatment for soft tissue injuries. One of the things I like to do off the bat is to talk to you a little bit about what ART is not. There's a lot of different misconceptions out there. People think they've had active release. Active release techniques is not chiropractic care, although many of the physicians who are ART providers are in fact chiropractic physicians. Chiropractic really refers more to the manipulation standpoint. Active release is really more of a soft tissue manipulation. Another thing that's commonly compared to is massage, and we're going to be posting some videos where you'll be able to actually see demonstrations of active release, and you'll see there's quite a distinct difference between massage and active release. One of them being the high degree of specificity that is involved with active release. There's over 500 protocols for all of the major muscle groups in the body. Combined with the fact that we use an active patient motion, which we'll get into in a minute. The other thing that commonly hear people confuse active release with is active isolated stretching, which was developed by Aaron Mattis. And active isolated stretching is a very effective way for stretching. However, it's not a soft tissue manual therapy, and that's what active release is. ART is a patented non-invasive soft tissue treatment that basically is used to treat professional and recreational athletes and otherwise active individuals. It's a non-invasive hands-on treatment whereby the practitioner can locate and detect scar tissue within inside of a muscle or a group of muscles, and then use that technique to break up and release the scar tissue. One of the best ways to describe that is if you think of normal muscle tissue, really the muscles are designed to glide like silk on silk. All the muscles are encapsulated with fascia, and that fascia is allowing normal freedom of motion between the soft tissues. Basically, if you had two pieces of Velcro stuck together, that can represent what occurs in soft tissues when you develop an adhesion. Like I said, normally you have muscle layers that are overlapping each other, running in different angles, and the tissues normally are able to glide freely without a lot of friction. Over time, due to overuse or micro trauma, sprains and strains, you'll start to develop some breakdown in the muscle, and the body's way of dealing with that is to lay down collagen, which is very inelastic scar tissue. And over time, that starts to proliferate, and you actually get a situation where the muscles actually now become stuck together. And so if I were to just simply get in here and press on this area, it's not really going to help me to release this tissue. What I've actually got to do is get my hands between that and move both muscle groups. And that's what active release really does. If you think about having a knot or a trigger point inside of a muscle, normal muscle tissue needs to be able to stretch and to relax. That's what normally happens during normal movement. If you take a knot inside of a TheraTube like this, that actually represents what happens with scar tissue inside of a muscle. As I pull on that, let's say for instance I'm trying to stretch, everything around that area of scar tissue or injury will stretch, except for the injury itself. And over time, if I continue to use that muscle, that's going to create further wear and tear on that area. That area of scar tissue is actually going to get bigger and start to create more problems, more pain, decreased range of motion. So what we need to do is to apply a treatment like active release techniques to get inside here and actually break up and release the tissue that will allow stretching to occur in a more normal manner. Typically, initial visits for an active release exam usually last anywhere between 30 minutes to an hour, depending on the severity and the number of conditions we're evaluating. Treatments usually last between 15 and 30 minutes, again, depending on how many tissues need to be worked on. And the average treatment plan for most patients seems to be around 8 to 10 visits to resolve their pain, rehabilitate the injury, and get them back in the game. If you'd like to learn more about active release techniques, you can visit our website, tricoretherapy.com, or visit Active Release Techniques website, which is activerelease.com. You can look for a local provider in your area. They also have a lot of good resources there to find out more about active release techniques.